Prostate cancer is basically identified by either getting a family history or getting a detailed medical history and also doing some blood tests, some investigations which might involve invasive and some are non-invasive tests that is available. Okay, the first thing, we talk about the family history. From the family history, we'll know whether you have history of cancers. So the most important cancer that we worry about is family of prostate cancer, which runs in the family, or we have breast cancer, which runs in the family. So these things increases your risk of having cancer of the prostate. That does not mean that you are going to get cancer. We just investigate you a little bit earlier to see whether you're going to get any cancers. The second test that most often people will tend to do is doing a simple blood test. That basically involves doing PSA. PSA stands for prostate specific antigen. Do not be worried in case your PSA is on the higher side. There are so many reasons why the PSA tend to go up. Only one of the most important things that we're worried about is cancer. So that one, let us interpret the results. You must understand PSA stands for prostate specific antigen. So what it basically says is it's very specific to the prostate. It is not specific to the tumor. So in case you have prostatic infection, you are constipated, if I do a rectal examination, all these things tend to elevate the PSA a little, but that does not mean that you have cancer. The third thing that when you come to the clinic, especially urologists, we will tend to do is, we will do a rectal examination, and using this ultrasound here, I will do an ultrasound to see the size of the prostate. During the rectal examination, as you can see here, what I tend to do is, with the gloved hand, I put my finger at the back passage and feel the prostate at the back. The whole procedure is a very short procedure, just less than 10 seconds. We will feel the prostate, and what we're looking for in the prostate is smoothness of the prostate. We don't want to see anything like this, nodular, like hard stuff. If it's nodular, then I might request you to do further tests. This test involves radiological examination, like an MRI of the prostate. When we do the MRI of the prostate, there is specific MRIs that we request for. We do not request for a simple prostatic MRI, we respect for the multi-parametric MRI of the prostate. During this thing, the radiologist will do some calculations. You don't have to worry about those things. They do some calculations and they will tell me where the possible areas of cancer that I have to look out for when I'm planning to do a biopsy. And once that results come back to me, we will have a discussion on how we're going to proceed, and following that we will decide whether we will use this machine, which is the simplest form, under sedation, where I'll put it through the back passage and take a biopsy of the prostate, or we do the newest type that is known as the fusion biopsy, where basically we fuse the images from the MRI to the machine and we do a biopsy which is very targeted to the prostate. So it is very minimal, invasive, and we will go in and take the biopsy from the prostate, and after that we will send it over to the lab immediately. The results should be out within 2 to 3 days, and after that we will come back and discuss with you what are the possible treatment that is available for you.
Untuk video kesehatan lainnya dapat dilihat di kanal YouTube kami atau video di layar ini.